What is RPI deficiency? Imagine having one of the rarest health conditions in the world. Only 3 people have ever been diagnosed with RPI deficiency. It's a super rare genetic disorder that affects a teeny part of how our bodies use energy. What is RPI? RPI stands for Ribose-5-Phosphate Isomerase, a special protein found in our cells. Its job is to help change one type of sugar, d-ribose-5-phosphate, into another, d-ribose-5-phosphate, in a process called the pentose-phosphate pathway. Think of it like a sugar factory inside your body, making the building blocks for DNA and RNA, which are super important for your cells. Scientists are also looking at RPI as a possible treatment for diseases caused by parasites like Sarko's disease and sleeping sickness. History of RPI deficiency. The first time RPI deficiency was found in 1999 when a 14-year-old boy was having trouble with his development, motor skills, and had seizures. Later, 2 more cases were reported. These patients showed problems like difficulty walking, seizures, and brain abnormalities. What causes RPI deficiency? RPI deficiency happens because of changes, mutations in the RPI gene. This gene normally tells your body how to make the RPI enzyme. When it's broken, your body can't make the enzyme, and that affects the pentose-phosphate pathway. This pathway helps your body make RNA and DNA, so without it working properly, you can have serious health problems. Symptoms of RPI deficiency. Here are some things doctors have noticed in people with RPI deficiency. Neurological problems with the brain and nerves, delays in learning and movement, intellectual disabilities, seizures, a sudden burst of electrical activity in the brain, problems with muscle control. White matter brain disorders. White matter is like the wiring in our brain that helps send messages quickly. When it doesn't work right, it can slow down how our brain communicates, leading to issues with movement and learning. Muscle stiffness and pain. Vision problems. Damage to the eyes leading to vision loss. Uncontrolled eye movements. Hearing problems. Ringing in the ears. Hearing loss. Weaker immune system. These kids may get sick more often because their immune system isn't as strong. How do doctors find out if someone has RPI deficiency? Doctors look for clues in the symptoms we talked about earlier, like seizures or trouble with movement. They use spatial machines like an MRI scanner to take detailed pictures of the brain and check for any changes. They might also test your urine to see if it has unusual sugars in it. These tests help doctors understand what's going on inside the body and figure out if the pentose-phosphate pathway isn't working properly. So, can it be treated? Right now, there is no cure for RPI deficiency, but there are ways to help with some of the symptoms. cerebral ataxia. This means having trouble with balance and movement. It's like when your body doesn't move the way you want to, making you feel ugly or clumsy. Medications and lifestyle changes can help. Optic atrophy. Regular eye checkups can catch problems early. Seizures. Anti-epileptic drugs or a special diet can help control seizures. Muscle stiffness, spasticity. Stretching exercises and therapy can help with muscle pain. Eye movement problems, nystagmus. Glasses or contact lenses might help reduce eye movements. Why is it important to learn about RPI deficiency? RPI deficiency might be incredibly rare, but learning about it helps us understand how special and unique our bodies are. Even though there is no cure yet, knowing more about rare diseases can lead to better treatments in the future. So, stay curious. The more we learn about the body, the more we can help those who need it. And who knows, you might be the one to discover something amazing one day.